Good day, folks. Alfie Vente here once again of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a charmingly good day. C for charming. Today I'm going to talk about 9 reasons why you may be lacking improvement in regards to your treatment. So these are 9 reasons. But before we do that, please like, share, subscribe, pass this on to those that you feel this might be helpful for. We want to thank you in advance. Also, I would like to thank our friends from ESRT Italian Menswear, terrific menswear there, at Royal Bank Plaza, and also Daily Ritual located at 1 King West Hotel. This is at King and Young. They have terrific coffee and great food there. As our own little part to help jumpstart the financial district, Vente Pain Relief Clinic patients will receive a credit to those 2 locations. Again, thank you very much, ESRT, and also Daily Ritual. Also, if you're a business located in the financial district and you feel that we are a good fit, give us a call, email us, and we'll talk. So now, let's talk about the 9 reasons why you may be lacking in regards to your treatment, in regards to improvement. So here is the scenario. You may have been assessed or diagnosed with a soft tissue dysfunction or injury, and this is maybe from multiple therapists, multiple doctors are saying the same thing. You've gone to multiple treatments over a few weeks, maybe months, some maybe even years, but feel that the improvements seem to be mysteriously lacking. So this is a very common scenario for Vente Pain Relief Clinic patients. They've had treatments. Generally, I tell patients that we're usually the last ones called in regards to these kind of things. And the reason for that is because because of our treatments, how intense it is, it's not typically something that people want to go through. But anyways, here are the reasons for why you may be lacking improvement in regards to your treatment. The first 3 are kind of outside of hands-on treatment, typical hands-on treatment. These are kind of more on the periphery, but they do impact your treatment. Number 1, there could be an underlying issue that has yet to be diagnosed. This is more of an extreme circumstance. Typically, patients who have gone through multiple treatments have also gone through multiple Western type of diagnostics, and they all show negative. What I find is that just by process of elimination, it typically points at more soft tissues. Again, this is an extreme circumstance where something has yet to be diagnosed. Typically, though, again, it's more something that has yet to be actually located in terms of what's the primary exacerbator or the root cause of the problem. That's number 1. Number 2, you have been inconsistent with treatment as suggested by the practitioner or inconsistent with the exercises that you have been given, or maybe both. So this is something where, one might say, well, I just haven't had the time, or I forgot to do the exercises. But there is 2 parts to treatment. One is the hands-on stuff that your therapist does with you, and then the second part is your part. If you're not doing those typical things that the therapist has instructed, there's a reason for that, why they're giving those instructions to do, then the improvements will definitely lack. Number 3, there could be a lack of communication between therapists. Now, I'm big on communicating with whichever therapist, other therapist the person is working with. I don't believe in sort of being a standalone in regards to having that Messiah complex where you think you have all the answers. Sometimes what will happen is you'll have philosophical differences between therapists, but therapists should actually be communicating with each other, throwing out ideas that may be helpful. So that is number 3. So the next items are basically more of the hands-on, deal more with the hands-on kind of stuff. So number 4, there's more of a symptom-based approach as opposed to finding the actual root cause or primary exacerbator. So what typically happens is a person comes in and they'll tell me, oh, I've had my back work done if they've got lower back issues, and that's what they're zoning in on. So the problem with that is that because it is a symptom-based approach, there could be a lack in terms of trying to find potential exacerbators or maybe even the root cause. So that's a very typical thing that happens when people come in. So before we go on to the next items, I also want to remind you for potentially new patients, there are three ways to get your first initial appointment. The first way is through a referral from a current Vente Pain Relief Clinic patient. The second way is we have a recommendation form that you can download off our website, and you basically take this to your healthcare practitioner. They read it, sign off on it, and you bring it to treatment. And finally, we have a self-assessment tool on our website that you can read through, follow the instructions, and it'll help you, it'll guide you in terms of whether the treatment will be beneficial to you or not. So now let's go on to, let me just turn the page here. So now we're on number 5. Strengthening exercises are done without improving the range of motion first, thereby feeding more into future chronic problems. And this could be typical for somebody who's doing exercises themselves without actually getting the blessing of their therapist, thinking that by strengthening a certain area, doing certain exercises, that it should help them, it should benefit them in terms of maybe decreasing the pain. But what happens is that if, say, an area is tight, the range of motion decreases, and therefore you're doing those exercises without the proper range of motion, and you're feeding more into the problem. And this will happen, and I've seen it happen, and people will say, well, it's gotten worse. Well, of course it's gotten worse. You're exacerbating the issue. You haven't done the proper process in terms of getting into that strengthening zone, so to speak. Number 6, pinpoint accuracy may be lacking. It is my experience that if you are off by a few millimeters, and I tell this to patients all the time, in regards to targeted work on the soft tissues, it makes a large impact on treatment outcomes. So I know this because when I work on a certain area, the feedback that I get often is, wow, that really hurts. That's the most painful spot that you've hit. I don't want to avoid those areas. What I want to do is I want to find those areas and work on them. The worst thing you can do is you find the area, and because the patient says it hurts. By the way, when a patient says to me that it hurts, it's more feedback. I will ask if they want me to, maybe lay off it or actually stop altogether. So just so that you guys know. I just don't dig in. I want to make sure that there's proper communication. So one of the worst things that can happen is that you're on a spot, the therapist is on a spot, just because the person says, oh, it hurts or in pain. They translate that as, oh, I got to get away from this area. When in reality, the treatment should be directly on that spot, particularly when you're getting that feedback. Number 7. There are structures up and down the chain that have yet to be really focused on. And this is very typical for a lot of chronic pain patients, especially lower back and hip. And what I mean by that is that they may have gotten treatments specifically on the hips, specifically on the lower back. But when I look down the chain, such as the hamstrings, the calves, I notice that the calves and the feet are extremely tight. So what I typically do is I work on those areas. I really dig into those areas to try to soften them up. And miraculously, the person feels a lot better. There tends to be more of a long-term result, positive result because of it, as opposed to sort of just working on that specific symptomatic spot. So that's number 7. Number 8, another typical one that happens is the treatments are too superficial. So I'm specifically talking about anybody that's working on the soft tissue. If you're just kind of working lightly, doing more of a relaxation type of treatment, if the issues are a lot deeper, if say there's scar tissue that's deep within the muscle fibers, deep within, for example, the back, which I think has about 4 layers, working on it superficially is not going to do the job. You got to go in there and actually find those spots and dig in and see if you can release those tight spots. So that is number 8. Number 9, and this one, because the base of my work is this, number 9, the muscles are treated more than the fascia. So typically chronic tightness and pain stems from very tight fascia. So there's a lack of differentiation between muscles and fascia. So you may have heard the term myofascial. Typically what happens is that the treatments are one and the same. You're working on the muscles, you're working on the fascia. For me, I actually divide it. So the way I see working on the fascia and the muscles, that maybe this person has 80% tightness of the fascia, it's impacting the pain. Maybe it's more 20% of the muscles. So what I do in terms of treatment is that I really zone in on the fascia, especially if the person's had chronic issues. Maybe what has happened is that the muscles are treated, they try stretching the muscles out without actually working intensively on the fascia. I've had fascial treatments. I've done treatments where I'll work on the fascia for maybe 45 minutes to close to an hour, and the person feels definitely better. There's a lot of discomfort, particularly if it's very, very tight. So there you go. Those are 9 reasons why you may be lacking in terms of improvement with your treatment. If you've got any questions, please feel free to give us a call at 416-644-8894. That's our clinic number at the Financial District, King and Bay, First Canadian Place. You can email us at admin@ventepainrelief.ca also. My name is Alfie Vente, and please like, again, share, subscribe, pass it on to what you feel this might be helpful for. My name is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. Have yourself a great day. Until the next video, take care.